as I have said, we are going live tonight for the third episode of The Doctor is In. And I hope you guys are ready. And if you also have your questions, you can also send them over at our inbox and on our chat room. So before that, I just want to say hi to Genjo Pagkaliwagan. Good evening sa inyong lahat sa QNCC Sandplant Boys. Manny, Bert, Andy, Rafael, Rene, Bernard, Ryan, Kevin, Frandy, and Genjo. Good evening to you guys, and also to Rosalie Menjola. So magandang gabi sa inyong lahat. And for tonight, as it is, I believe it is Thyroid Awareness Month, I am here with our very special guest. I am with Dr. Eiad Tarek. Good evening, Doc.
Evening.
Yes, how are you tonight, Doc?
Fine, alhamdulillah. How are you?
I'm good. Thank you, Doc. So tonight, we are going to talk about thyroid. You are an endocrinology specialist, and he is one of the most experienced endocrinologists in the region, you guys. He's got more than 15 years of experience. And now, for my first question, what is thyroid, Doc Eiad?
Oh. Thyroid is a butterfly shape endocrine gland, usually located in the lower front of the neck. Its function making thyroid hormone.
Hormones, yes.
Thyroid hormones secreting to the blood, and the blood carrying these hormones to the all tissue of the body. Thyroid hormone help the body to use energy, making you warm, and keep the brain, the heart, all organs of the body working normal as they should.
Okay. Yes. So thank you for that, Doc. But two of the most two words that I always encounter when we talk about thyroid is hyperthyroidism and hypothyroidism. So what is the difference between the two?
Hypothyroidism, that's the chronic disease. Both is a chronic disease, hyper and hypo. But hypothyroidism, that's happened when the thyroid cells is not able to make more thyroid hormone. And that's good thyroid hormone deficiency, usually. Then no thyroid hormone, enough thyroid hormone in the blood. Okay, that's hypothyroidism. Hyperthyroidism, the opposite side. That's when the thyroid cells secreting more thyroid hormone to the blood. That's hyperthyroidism.
Okay, so it's kind of like hypothyroidism is the thyroid gland is underactive and the other is overactive. Oh, okay. So what are the causes of these, well, as you've said, the chronic disease? Yeah.
For hypothyroidism, there's many reasons, but usually the main reasons are autoimmune disease. Autoimmune disease when the immune system in the body should defense from the body, attack the thyroid cells and destroy the thyroid. That's good about making about 80% from all the hypothyroidism in the adults, and good Hashimoto disease.
Hashimoto disease.
Otherwise, there's other reason for the hypothyroidism is surgical removal of the thyroid for other reasons like tumors or cancers, or treatment for the hyperthyroidism by radioactive iodine, or other rare reasons. But that mainly that's Hashimoto disease, autoimmune disease, and surgical removal and the treatment by radioactive iodine. That's the main reason for the hypothyroidism. For hyperthyroidism, also we have main reason is the autoimmune disease.
Yeah.
That's called grave disease. That's enlargement of all the thyroid lobes, enlarged and secreting more hormones to the blood. That's good grave disease.
Grave disease.
Grave disease. Second reason is the multinodular goiter, enlargement of the all thyroid, and there's many nodules secreting hormone to the blood, or one big nodules secreting hormone to the blood. That's the main reason for the hyperthyroidism.
Yeah, so those are the differences in the causes of hypothyroidism and hyperthyroidism.
Hypo
The first one, and then hyper.
First hypo and the second hyper.
Hyper, yes. And is there a cure for these, Doc? Like the symptoms, what are the symptoms? Or can this be cured?
We talk about the symptoms for hypo and hyper.
Yes.
For the hypothyroidism, sometimes asymptomatic. It will take long time
For hypo.
for hypo. Usually, because thyroid hormone help the body to use energy, and the metabolism is slowing
Slow,
down.
yeah.
Slow. So that in that time the weight is increased.
Yeah. So you gain weight.
Gain weight. You feeling cold and weakness, and the patient want to sleep all the time, sleeping, and you'll get constipated.
Be, basically because the metabolism is really
Yes.
slow. Yeah.
Really
Okay.
slow, and usually there's family story about the hypothyroidism. There is family story for the Hashimoto disease.
Yeah.
I said about 80-85%. The main reason for hypothyroidism, Hashimoto disease.
Genetics.
Genetic. So there's family story about the thyroid. Sometimes there is iodine deficiency. That's in the mountains area. There is no iodine in the food.
Oh,
water.
yeah.
Yes. But mainly hypothyroidism for Hashimoto disease. There's other reasons. I talk about the thyroiditis, that's inflammation of the thyroid, but it's not very chronic. Maybe happened for months and finished. Okay, for hyperthyroidism, the symptoms is aggressive. There's weight loss because the metabolism is high.
So it's really just the opposite of
Yes,
the
in
other one.
opposite side. So you will lose more weight and sweating, and you feeling hot, and palpitation, heartbeat is high,
Yeah.
and sometimes weakness and pain in the arms, in the upper arms, or in the upper side of the arms and the thigh,
Okay.
the muscles.
So those are the symptoms of
Yes.
hyper.
Yes, that's for the hyperthyroidism.
As for the cure, Doc, what are the treatments for hypo and hyperthyroidism?
The treatment for the hypothyroidism is the antithyroid agent. Antithyroid agent, usually we use two medicine. For the hypothyroidism, we use the replacement therapy. The thyroid hormone. Usually we have one medicine is L-troxin.
Okay.
That's the thyroid hormone. About the dose is different between the people because there's complete hypothyroid and incomplete hypothyroid. For the complete hypothyroid, about the dose, usually about 100 microgram. But for the incomplete subclinical hypothyroid, the dose is different between 25 to 50 microgram.
Okay, so
For the hyperthyroidism, we use antithyroid medicine. We have two medicine for the hyperthyroidism. Metimazole, that used for, we'll start with high dose and gradually we reduce the dose.
weird. Okay.
But usually the treatment take between 1 year until 1.5 or 2 year maximum. But the recurrent in the future is very high.
Oh, okay.
Second medicine, usually we use propylthiouracil, but that for special cases when we have contraindication or in the pregnancy is better to use propylthiouracil. Okay.
Yeah, so there are medicines to be taken as treatments for
Yes.
hypo and hyperthyroidism.
Hyperthyroidism, there's another ways. There's surgery.
Surgery, okay.
Surgery after control the thyroid. We can process for surgery, surgical removal of the thyroid gland. And the third way is the radioactive iodine.
Oh, okay.
Radioactive iodine, the thyroid cells absorbs the iodine and concentrate in the cells. And the radioactive iodine kill the cells, the
Yeah.
thyroid cells.
Okay, so that's for hyper.
For hyper.
Yeah.
For hypo, only L-troxin. There's one
L-troxin.
one medicine.
Okay. So, Doc, I've read somewhere, please correct me if I'm wrong, that thyroid problems or thyroid diseases are more current or it's more likely to be present in women than in men. Is that true?
For the grave disease and Hashimoto disease, for the both hypo and hyper, is more famous usually in the women.
Oh, okay.
In the woman. But for the cancers
Can occur in
no
both.
different between men and women. But for the hypo and the hyper is famous in the woman.
Women. Oh, but why is that, Doc? Why is it more like...
It's unknown,
Oh.
but it's more common in the woman.
Oh, because they said, well, I've only just read this, so of course I am consulting you, Doc, that it occurs especially after pregnancy or after menopause. So is that kind of related? Is that true?
It happens sometimes the hypothyroids happen and in the second the hyperthyroid, but mainly hypothyroid happens in the pregnancy.
Oh, okay.
Sometimes happen in the pregnancy, but maybe it's finished after the pregnancy and sometimes continue. That's the hypothyroid. Hyperthyroid is less common from hypo
Yeah.
in the pregnancy. But for the menopause, nothing.
Oh,
It's amid any age.
yeah. So it can happen.
Yes.
Yeah. So, Doc, you also mentioned thyroid cancer.
Yes.
So, what are the symptoms? Like, how do you know if you have symptoms? How do you know if your thyroid problem is already serious, or you should go to, like a doctor and consult already?
Thyroid cancer is uncommon compared to other body
Cancers.
cancers like the breast or the colon cancer.
Yeah.
And usually is very treatable.
Oh.
And often is cured by surgery with or without radioactive iodine. Symptoms usually asymptomatic, no symptoms for thyroid cancer, and usually discovered by routine checkup
Okay.
when the patient do scan or ultrasound for other disease. He can find thyroid cancer. And sometimes the patient, not when he look to his neck in the mirror, he can feel there's nodules or not one nodule or many nodules or lump in the neck.
Yeah, the lump.
Usually no symptoms, but if the tumor is big and can compress the other organs in the neck, like the windpipe or esophagus, can cause difficult in breathing and maybe swelling.
Okay.
And if the tumor is very aggressive and spreads to the nerve that control the vocal cord, maybe sometimes cause hoarseness.
Hoarseness.
And also the blood test is normal with thyroid cancer.
Okay.
Thyroid function, TSH, and other hormone FT4 and FT3 is normal. But usually discover when routine checkup.
So routine checkup.
Yes.
So that's why it's also really, really important that you go for checkups regularly. And I think part of or one of the reasons why we also celebrate Thyroid Awareness Month is because many people do not know that they already have thyroid problems or thyroid cancer. So it's really also good that we're having this discussion tonight for all of our listeners, Doc. And for now, for my next question, are there types of thyroid cancer?
There's mainly there's 4 types of thyroid cancers. The papillary thyroid cancers is the most common thyroid cancer, is making about 70 to 80%. Papillary cancer.
Okay.
And it's growing slowly and spreads to the lymph node of the neck. But the prognosis is excellent. And the second type is the follicular thyroid cancer. It's making about 10 to 15% and also growing slowly. But less common from thyroid cancer to spread to the lymph node of the neck. But it's more common to spread to the distant organ, like the bones or the lungs. The third thyroid cancer is the medullary thyroid cancer, MTC. Medullary thyroid cancer is uncommon and making about 1 to 2% from all thyroid cancer, and 25% run in families.
Okay.
and associated with other endocrine tumors. That's called MAN1 and MAN2. That's syndrome. And it's more aggressive. And
The medullary?
yes, more aggressive from papillary and follicular, because papillary and follicular is known well differentiated thyroid cancer,
Okay.
and it's good for the prognosis. For the medullary cancer is not differentiated or undifferentiated thyroid cancer. For the last
For the
times is
fourth,
the
yeah.
anaplastic thyroid cancer. That's the more advanced and aggressive thyroid cancer, and it's growing very, very fast, and spreads to the lymph node of the neck and to the distant organ. And the less respond for the treatment, and not respond to the iodine therapy, radioactive iodine,
It's called anaplastic.
anaplastic.
Okay.
And the prognosis is bad.
Oh,
When
for
discovered this thyroid cancer, the prognosis is bad. Not like the papillary and
Follicular.
thyroid cancer.
So, what about chemotherapy for thyroid cancer? Is that the most common treatment?
Treatment, the main treatment is the surgery for all types
Surgery,
of
yeah.
surgery for all types of thyroid cancers. But sometimes when there's when the thyroid cancer, we talk here about the papillary and follicular. When there's big cancer and we cannot remove all the tumor, and there's remaining cells, tissue for the thyroid, we follow the surgery by radioactive iodine
Okay.
to destroy all the normal and the cancer cells. Okay? For the follicular, for the medullary cancer and the anaplastic cancer,
Yeah, the more
no
aggressive
respond
ones.
for the radioactive iodine. No use. So we'll follow the surgical procedure by the chemotherapy,
Oh,
and sometimes by the radiation
okay.
of the neck.
For the more aggressive types
Yes.
of thyroid cancer. So, since we're already talking about this, Doc, what are the treatments that Naseem Medical Center offer for thyroid, for patients with thyroid problems or thyroid diseases?
Yes, we do the consultation with the expert, with the endocrinologist. We also offer the blood test,
Yes.
thyroid hormones, all the thyroid hormones. We talk about TSH, FT4, FT3, anti-43. Also, we will offer the thyroid antibodies for the autoimmune disease, like the anti-TBO and anti-thyroglobulin and anti-proxinase. And also we have anti-TSH for the grave disease, and also we offer the ultrasound for the patient if they have enlargement of the thyroid, or they have nodules or tumors. Also we have CT for the neck. We can do, and also we have pharmacy offers the medicine. We have also the medicine for the hypothyroidism and for the hyperthyroidism. And, that's what we offer for our patients.
Okay. So,
And also for the surgical, now new daycare in the Searing, in Naseem Rabia.
yes.
I work in Al Wakra branch, but
Yes.
they have surgery department. Now they'll start before few months. We can send the patient for surgical procedures for the thyroid.
Okay. Doc, thank you for that, of course, first of all. But we have a question here from Marnie. Is SVT considered a thyroid-related case
Yes.
since it involves palpitation?
Yes, that's happened in the hyperthyroidism. I say the heartbeat is high. So in the some adult people, some adult patient, they will have SVT, supraventricular tachycardia.
Yeah. So,
And usually we see the patient, they have a high rate of the heartbeat of the heart, with SVT, sometimes with VT, tachycardia,
Yeah.
and SVT, or sometimes the pulse is normal. Sometimes the pulse is normal because according to the patient age, and if we have chronic disease like hypertension or heart diseases like this. But usually the heartbeat is high.
The heartbeat is high.
Is high.
Okay, so
That's in a hyperthyroidism I talk.
yeah.
Okay.
And Doc, what can you advise for our listeners who are tuned in right now? Of course, you've already mentioned that it's important to go for a routine checkup, but on their lifestyle, like on the daily, what can they do to like take care of themselves more, especially with thyroid related cases?
Usually the routine checkup is very necessary for the neck, at least every 6 months. We check by doctor. And when we have family story about thyroid, any types of thyroid, hyperthyroidism or hypo, or thyroid tumors, cancers, the routine checkup is very necessary for those patients. And the healthy food is necessary.
Yeah, the diet.
And should contain iodine. Iodine will help thyroid because the main product of the thyroid hormone is the iodine.
Yeah.
And iodine usually found in the seafood, fish.
Yes.
So it's better to eat at least one time in the week, seafood or sea fish.
Okay. So for my last question, Doc, do you have people that you want to thank or people that you want to greet who are tuned in right now? You can greet them and say hello to them.
I don't
Go ahead, Doc. Your fellow doctors or your nurses even. You can say hi to them. Yes,
Yes.
Doc. You want to say hi to them?
Yes.
I think Doc
have
is
many
quite
friends,
shy.
yes.
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 So saying hi to Doc Eiad's friends and
Because you know
workmates.
I work here in Doha about 8 years, and many of my friends in my old clinic and in my new clinic
Yeah.
from
Oh, okay.
national.
Okay. Okay. So saying hi to everybody, of course, to the patients even of Doc Eiad. And thank you so much for this very enlightening discussion about thyroid. Of course, this is also in a celebration of Thyroid Awareness Month this January 2021. So this third episode of The Doctor is In is brought to us by Naseem Al-Rabi Medical Center, Wakra Branch. So thank you so much. Maraming salamat, Doc Eiad. So I hope you enjoyed our discussion with Doc Eiad. And yeah, I hope you guys learned a lot tonight, and please remember to go for checkups and have a healthy diet, as what Doc Eiad has said. So I will be taking a very quick break, and then I'll proceed to playing your favorite jams maya lang. So that was again Doc Eiad Tarek from Naseem Medical Center, Wakra Branch. Thank you so much, Doc. And yes, this has been The Doctor is In's third episode, and you are gonna be with me until 9 p.m. tonight. I'll be pausing for a break right now. This is Trish now on the after shift, only here on Qabayan Radio 94.3.